The simple answer is removal of all or part of thyroid gland, which is a gland situated in the middle of the neck. I would like to answer this question by explaining briefly about thyroid and parathyroid. Thyroid and parathyroid both are endocrine glands situated in the middle of the neck. Thyroid looks like butterfly, which is in front of the windpipe, and behind thyroid gland there are 4 small glands called parathyroids, usually described as size of grain of rice. So there is right upper, right lower, left upper, and left lower parathyroid glands. The approach is through incision at the bottom of the neck, in front of the neck, in order to get to the thyroid. If it is thyroid surgery, only thyroid is removed with the preservation of parathyroid glands behind it. For parathyroid surgery, the thyroid gland is mobilized and the diseased parathyroid gland is removed. The surgery for thyroid and parathyroid have different indications. For thyroid, it could be for benign disease or malignancies, or sometimes for diagnosis in order to confirm the nodule, whether it is cancer or non-cancer. For benign disease is usually as a result of multinodular goiter, which can cause compressive symptoms, or uncontrollable hyperthyroidism, that's excessive thyroid hormone secretion, or in conditions like Graves' disease. As I mentioned earlier, sometimes the procedure is performed in order to confirm diagnosis after cytology is showing suspicious appearance. And finally, the main indication for thyroid surgery, apart from benign disease, is malignancy. If it is confirmed, then surgery is indicated. And the main indication for parathyroid surgery is usually benign disease, which causes enlargement of the gland, and as a result, it affects calcium regulation in the blood. Operations for thyroid surgery depends on indications of the surgery. For example, if the surgery is performed for overactive thyroid or compressive symptoms, obviously these can be addressed. If the surgery is performed for malignancy, then obviously the surgery is done to remove the cancer. Parathyroid surgery is in order to control calcium level by controlling parathyroid hormone level, which is excreted from enlarged gland. Therefore, removing of diseased parathyroid can normalize the level of calcium in the blood. The recovery time usually depends on type of treatment. For example, if part or half of the thyroid is removed, obviously it's less than patient having total thyroidectomy. But in general, it should take about 1 to 2 weeks recovery. Of course, I would not recommend activities such as heavy lifting for up to 3 to 4 weeks after surgery.